Hey girl, hey, it's your birth bestie, Nurse Rini, and I am here with another Reddit story for you. Now, this is a good example of why I am on Reddit, and it's because I do like to peruse the maternity streets, the prenatal streets, to see what people are saying and answer questions within the chats, but I also bring them to a broader audience like you here on TikTok or in my Instagram and YouTube channel. So, this post is from gestational diabetes, and I'm feeling really passionate about this, so I had to take it some time and let it simmer down before I responded to the person who responded to OP, but also before I posted it because I didn't want to post with negativity. So let's dive in. So be warned, this may turn into a little bit of a rant, but it says, should you induce at 37 weeks? Advice wanted. Hi again. I made a post a while back about how to manage numbers for gestational diabetes. Long story short, I was put on metformin due to my fasting numbers being elevated. So what she is saying is that she was diagnosed with gestational diabetes, meaning she was diagnosed in pregnancy, and this diabetes is related to pregnancy specifically. Because her blood glucose was high, they went ahead and put her on oral medication, and it's called metformin or glucophage. Okay, so since then, my fasting numbers are repeatedly around 100 to 110. Fasting meaning she wakes up in the morning and she takes her blood sugar, and her readings are 100 to 110. So my endocrinologist upped my metformin dosage to 1,000 milligrams twice a day. Thankfully, my numbers are now under control for the most part, but I am having 2 appointments a week for NST monitoring and BPP ultrasounds. Now, NST stands for non-stress test, and that is when they monitor your baby. Just you're doing nothing, baby's doing nothing, you're just regular degular hanging out, and the baby is on the ultrasound monitor, and you are also attached to a contraction monitor to monitor how the baby is doing. Okay, and so a BPP test is a biophysical profile, and that is a scoring system that is used to further assess babies while they are still inside of you. So between those 2 tests, these will tell us how the baby is doing at that time. She goes on to say, I was given the shot to develop my baby's lungs, and she's talking about betamethasone, okay? Recently, because my doctor said if the baby gets a 4 out of 8 on the BPP, he's going to induce immediately instead of waiting to see if she was sleeping during my sonogram or if it was a fluke. It has gotten to 6 out of 8 on 2 ultrasounds on 2 different occasions. So this is interesting because I feel like there's some context clues here. It says that one, she was given betamethasone, so it sounds like they thought that they would have to deliver her early or preterm. And it also says specifically that my doctor said if the baby gets a 4 out of 8 on the BPP, it sounds like maybe the baby has had a low BPP before, right? And then she goes on to say 6 out of 8 on 2 ultrasounds. So her baby is showing some janky signs that maybe something's going on in there, which makes sense because she seems to be an uncontrolled diabetic. So it goes on to say, because of all of this, my doctor is planning for an induction at 37 weeks. Is this standard for gestational diabetes? I recently attended a breastfeeding cafe and shared this information with the women, and they seemed appalled and said things along the lines of, quote, my OB wouldn't consider induction until 39 weeks, and I had type 1 and gestational diabetes. And your quote, your body won't make a baby you can't physically push out. They also mentioned that babies at 37 weeks struggle with latching, increased likelihood of a C-section, etc. Once I left this group, I felt like I was making a wrong choice by agreeing to an induction at 37 weeks. So I came in to respond because I felt bad for this woman, one, because she was getting, disinformation from random lay people that goes directly against what her doctor is saying. And honestly, this is the kind of thing that really upsets me because when people give bad information based on nothing, they put other people's lives at risk. And even me as a nurse, I don't give information to people and say, do exactly what I say. I say, hey, this is what the evidence says. This is the practice I've seen. You should, follow up with your doctor and ask additional questions if you have concerns, valid concerns at that, right? So this really drives me mad when people say absolutes and also contradict what the doctor says. I'm not saying that the doctor can't be wrong, but what I am saying is they have a medical degree and these other people don't. So, and having a baby doesn't necessarily qualify you to give this advice, right? So let's go on to what I responded with. So I respond with, as a nurse, I think you are thinking along the right lines. 37 weeks is pretty standard for labor induction for medical reasons. The type 1 diabetic could have had better glycemic control than you, so she can't compare herself to you. And I'm talking about the person who told her, I have type 1 and I wasn't induced until 39 weeks. Yeah, your situation was probably different. I've seen plenty of inductions go on to have successful vaginal deliveries, and I've seen those same 37 weekers latch beautifully. I've also seen 40-week babies not latch well at all and have respiratory problems. My point is that every situation is different. What I will say is a shoulder dystocia is super scary, but even non-diabetic moms who have big babies are at risk for them. The moms making you second guess yourself have probably never experienced a shoulder dystocia, nor broken a clavicle or Erb's palsy, or they probably wouldn't have been so adamant about not having an induction. Meaning these women didn't have any complications, right? And so they're going to tell you to do all these radical things because they haven't seen what an obstetric emergency looks like. So there's that. I go on to say that I think you should ask all the questions you can and ultimately feel good about your decision. And that's how I operate. If something is absolutely unsafe, I'll let you know. But otherwise, I say, do what makes you feel comfortable, but make sure you have all of the information to make the best decision and the safest decision. Maybe you can ask how big your baby is measuring now and what the expected weight might be if you go past 37 weeks. That might give you more info to work with. Ultimately, it's up to you. Ask all the questions and weigh them, and you'll know what to do. It already sounds like you do. And then I left my YouTube handle. So, OP also said in her post that when she spoke with her OB recently, she asked him to explain the risk of carrying longer than 37 weeks, and his largest arguments were increased size of the baby, mine is measuring large for gestational age, and my first child was 8 pounds 11 ounces with gestational diabetes, shoulder dystocia, and possibility of broken clavicle or detached nerves in the shoulder, and the increased risk of having a stillborn. So she has a history of gestational diabetes, and her last baby was a big baby at average size baby, but still on a bigger side at 8 pounds 11 ounces. So her next baby is definitely probably going to tip the scales at 9 pounds, right? And that's pretty big. So anyway, she goes on to say, while mulling this over after my appointment, I came to the conclusion that I'd rather have to exclusively pump or use formula if there were latching issues, opt to have a better chance of delivering an average size baby if that meant an increased opportunity of avoiding complications caused by shoulder dystocia or possibly having to leave the hospital without my baby. I'm generally not someone that challenges my medical providers as they have significantly more experience and knowledge on these topics than I ever will. I don't know if that's the right way to think or if I'm being fear mongered into thinking this way. Any advice or experience? So this is what I'm saying. And this is why I responded to her like, you're thinking along the right lines. So yeah, look at what this woman says though. So you guys want to have to stay tuned for part two. But Lil Pistachio responds and says, this is not correct. See evidence-based birth on induction for gestational diabetes. TLDR, even for moms with gestational diabetes, outcomes are worse with induction before 39 weeks for gestational diabetes alone. Different story for hypertension or baby failing BPP, some other diagnosis. Y'all, this set me off. And so then I had to read her the riot act because who are you, ma'am? And I also do evidence-based birth, okay? I also get my medical journals and I read them, okay? I practice clinically. I'm also an educator, a nursing educator. I'm not just talking about evidence-based birth. I'm talking about what I've seen and what I know. But stay tuned for part two.